You all have been very attentive and asked excellent questions, so I'll try to not put you to sleep and be your best cure for insomnia. So I am going to actually start this a little bit differently than I planned. I'm going to skip a few of the slides and tell you about an experience that I had when I was in Brazil that really started this, helped me take this research in a very different direction. And it helps, this explains a little bit about how Spiritism has impacted my life very deeply. Not only the writings of Allan Kardec have impacted me deeply, but also an experience I had in Brazil. So as I told you yesterday, I went to Brazil initially just to try to see what was true, because there was an oncology nurse from Mass General Hospital in Boston who was sending me was telling people to send reports, medical reports, showing that they had had an accurate diagnosis and that there was proof of their recovery. And after enough people had sent these reports to me, I decided to go down to Brazil and see what was going on. And so I visited a number of healing centers in Brazil. I spent some time at a center outside in Abadiânia, was one of the places I spent some time at. And I spent the week interviewing people with medical evidence for recovery and accurate diagnosis. And then on Saturday, the day before I was to leave, well, let me just say first, there was a filmmaker from Ireland named Fergus who was in Brazil. When he found out that there was a doctor interviewing patients about their recoveries, he asked if he could videotape my interviews because he was doing a documentary. And so I thought that was fine. And so he spent the week videotaping the interviews I was doing. And then on Saturday, we did an interview with a mother and a son. And at the conclusion of that interview, we were walking down the dirt road in Abadiânia. And Fergus was asking me a bunch of questions with his camera yet. And it had been a difficult interview with this. I wasn't really sure what was going on. So he asked me a question about the interview we'd had. And I said, well, I believe it in my head, but not on my heart. I said, there's medical evidence that something happened here, but I just don't get how these healings occur. They're just way beyond me. I believe it in my head. I don't believe it in my heart. And he said, well, did you hurt yourself? You're bleeding. And I pulled up my shirt, and there was a little 1/8 inch horizontal incision on my chest over the area of my heart that had formed and started to bleed. And it bled for about an hour and 10 or 15 minutes and created quite a mess, and bandages would just fall off. So it was enough blood and it wouldn't stop, and it was quite a mess. And I looked pretty silly on tape because I had no idea what was going on. I was really confused and speechless. And so I went back to the United States the next day, and that was a really flattening sort of experience for me. I had been trained in seminary. I'd studied theology and philosophy of science. I'd been trained in medicine. I had just completed a residency in psychiatry as a new faculty member. I was a new medical director, and this experience turned my life upside down in a lot of ways, and my life began to change very quickly. I came from a very conservative world. I was born into an Amish childhood, and I'd had a lot of difficulty growing up. I left a lot of that and had progressively gone through all of this education in an attempt to figure out what was true. I was a very confused child. And so school became a way to just try to figure out what's really true, what's true in faith, what's true in our spiritual life, what's true in the medical world, what's true in psychiatry. And then to have this experience just turned it all upside down. And I don't, to this day, I don't really know how to understand that, but the way I have interpreted it, right or wrong, is that we are more these invisible souls walking around than we are our physical bodies. If you can say, I believe it in my head and I don't believe it in my heart, and then a little wound manifests on the skin over the area of your heart, that to me says that none of the way I'd been trained really is completely able to capture that. And so I have concluded that we are these invisible souls walking around, and that the appearances of who we are doesn't begin to capture at all who we really are. We are these images of God walking around, and the evidence of the five senses just doesn't capture the whole story. So that personal experience is very connected to the research that I did. I was very ontologically flattened after that experience. I left that research for about a year and a half, did not know what had happened in that experience, and then I went back on one night, and there was, I did a phone call with a woman while I was in Boston. She had had a healing of colon cancer during a meditation session, and I wanted to just get the CT scans from before and after this healing to see if the evidence supported what she was saying. So I got on the phone, talked to her. She was in California, I was in Boston. Then I talked to her son in Colorado. And then I got off the phone, and I went and took a shower. And I got out of the shower, and I was bleeding from the same spot again. And this time it only lasted like 10 or 15 minutes. There's a lot less blood. But that's just another indication that we are dealing with mysteries, whether it's near-death experiences or we're talking about hypnosis. There are powers of the mind and of the heart that are far beyond what we know how to capture in our paradigms. So there's that. I don't know how to understand it, but that's what I experienced. So I'm gonna skip a few of these slides because I want to get to I want to really talk very directly about the four pillars of health and well-being as I understand it, after all of these interviews I've been doing for years with these people who've recovered from illnesses after they were told they were going to die. So I'll just summarize the state of Western medicine as I understand it with this slide. I think Western medicine is brilliant, but I also think that Western medicine is really a long line of ambulances at the bottom of the cliff. And we have lots of ambulances there who whisk people off to the hospital and save lives brilliantly. But the question is, aren't there ways that we could put guardrails at the top so that people don't get sick in the first place? We don't have guardrails very much. I think that we are now opening a new era in medicine where we're going to start studying what those guardrails are. The people I study actually fell off the cliff, and then they were able to find ladders that took them back to the top, basically. And I think that if we can, they're the heroes of self-care. They're the heroes of well-being. They're the heroes of health and well-being. So I think it's helpful to study them, but I think we need guardrails at the top. What's fascinating to me is the same things that create guardrails at the top are the same things that these people did when they constructed their ladders. They just did them more intensely than most of us do. So I think that's one way to understand it. So Western medicine is brilliant, but we can be even more brilliant if we also have guardrails. So let's move ahead a few slides here. Okay. So what these slides are basically saying are some things that we talked about yesterday about how there's this whole movement in culture at a subconscious and a conscious level away from deficit-based ways of understanding the human being, whether it's in religion or psychology or medicine, and moving towards a much more positive understanding of the human person. So let's start here a little bit. We talked about this yesterday a little bit, where Western medicine has been very helpful to a point, but it still tends to focus too much on disease instead of what heals people. We cultivate, and what we need is a model that cultivates what's right and good and possible within the individual. We have spent a lot of time focusing on discrete disease states, but we too often neglect the deeper roots of many illnesses and the opportunities that illnesses represent. I'm fine with medication use, but I think we overuse medications. We don't use them sensitively enough. We use them as our only tool, and if the only tool you have is a hammer, they're going to treat everything like a nail. And I think we need to realize that diseases often represent an opportunity to get to change our relationship with ourselves. Every single person that I've studied with these amazing recoveries has said that they're so grateful for the illness in retrospect because it's so fundamentally changed their relationship with themselves. It's so fundamentally changed their experience of themselves in the world around them. So, I have this background in seminary and in medicine, and over time, I began to realize that we're really talking about some very different worldviews here. If you look, for example, in Spiritism or in the ancient faiths, there's a very strong sense that the person brings something really whole and complete into the world, already perfect. The soul is perfect, whole, and complete, and the person is more their soul than they are this individual body. If you look at the disease model, we see that the person is flawed. It needs something external to be supplied, whether it's a medicine or a technology. And so there's a place for that, but it's just not the whole story. If you look at the ancient spiritualities, Spiritism talks about the soul is immortal, and the point is to wake up. To wake up to these deeper aspects of who we are, to the possibilities of who we are. And that's very different in the Western disease model, where you focus on the deficit, you focus on treating the high blood sugar or the depression, but you neglect the deeper story. So, and the treatment tends to be very external. So, again, if you look at these ancient spiritualities, and Spiritism really captures a lot of what goes on in these ancient spiritualities. Divinity is within, both immanent and beyond, and that's a very complex dialectic. If you look at the way in which the Christianity that I was raised in, for example, which was very conservative, divinity was very much perceived as external, and Christ was not understood in the way it's understood in Spiritism. It's really an external force that saves you in spite of the blackness and darkness within you in a way that can be misunderstood, I think. The emphasis in spirituality is on connection and wholeness, on the goodness and value that a person brings. Western thought, I think, is really great about individual expression. I had a patient recently from Japan, and she said, boy, the news in the United States is so different than in Japan. She said in Japan, they try to be factual, they try to be rational, they don't get dramatic about it. And she said if you watch the news in the United States, it's these two parties that are just trying to kill each other, and everyone's trying to express their view. And I think that's all. I think individual expression is fabulous, but it needs to be done in the context of understanding that we're all in this together, and there's a connection and a wholeness that even though we might have different views, there's still a connection, and wanting to be able to hear the other side and realize that we're fundamentally human beings, that we want the same things. That's lost in the United States right now, if you haven't noticed. In the West, we talk about how illness begins in the body, and in medical school and in daily practice, that's a very strong belief that illness begins in the body, it begins and ends there. And in Spiritism, in spirituality, illness begins in the soul, and so the illness can be viewed as a message for what is the message that my soul needs me to learn, or what is it that I'm really trying to learn here with this illness? What's the opportunity here? So, whole is greater than the sum of the parts. It's so important to recognize and remember that, and things can become very contentious and fall apart if the emphasis is only on the parts, only on one part of the human being and the individual. So, to summarize this a little bit, the ancient spiritualities, there's an underlying perfection in the soul. In the West, I think there's been a mistake when original sin is made the primary reality instead of emphasizing that every individual is the image of God. If original sin is primary, that's a very deficit-based view. And I think things are starting to shift in the world around that. Ancient spirituality, the soul is immortal. Spiritism captures that really well. The Western thought emphasizes this life and this life alone. The immediacy of that is good, but it needs to have the context of the larger view. The soul is indestructible in spirituality. In Western thought, you only have the body, and the body is very destructible. We know that. For spirituality, the body is just a temporary envelope. Ancient spirituality, power with others, and rather than power over others. In Spiritism and in ancient spirituality, you really start to realize that the invisible world is primary, and that is the primary world, and the visible world is at some level an expression of that. But it's not the whole story. And of course, in Western thought, visible world is primary. And so these different worldviews take you in really different directions, and it's just important, I think, to be aware of the deeper constructs and beliefs in them. So again, the evolution of culture it's fabulous. The history is really going someplace. And so over time, we see a growing emphasis upon the underlying goodness and value of each individual human being. And so you see the rise of all of these things that are slowly coming out of the closet and allowing more respect for each individual human being, no matter what that is. And the rise of democracy, the rise of human rights and self-help, the movement towards strength-based approaches. All of this, I think you can see, was talked about in Jeremiah 31 in the Old Testament. All of this was talked about, this covenant with the divine where people would eventually not pay for the sins of their fathers. They could take responsibility for their own self, and each individual will be valued as important. So the future is about increasing reliance and trust in each individual's capacities for self-knowledge and self-determination. There's a lot of implications for that. Doctors become coaches rather than the experts over your life and body. A doctor who spends 15 minutes with you just cannot know the larger story of what your life is. And it's important that you begin to see your life as a journey, that we all see our lives as a journey for increasing self-knowledge, and to see our body as a clue for what it is that the deeper soul is trying to understand. The future of that means that in the future we will be less dependent on experts, hospitals, and labs, and more focused on the individual's needs and aspirations. I sometimes say, a little bit tongue-in-cheek, that in 5 years you'll get better health care in a remote village in India than you do in the United States, because the experts at Harvard and Stanford are still alive. So, so I live in a world where there's a lot of very intense kind of empires have been built on a particular view of the world, and those views of the world are preventing the younger people who understand some of this, millennials, for example, who really want to take more responsibility for their health, who are interested in nutrition and that sort of thing. And we need to support that. So I think it's a very exciting time. You know, back in the, I talk a lot about, I'm involved at Singularity University and in the tech world because, you know, in the Reformation, when Martin Luther helped spark the Reformation, that could not have happened if there had not been the folio and the printing press coming out at that time, and that allowed a whole, so technology helps a new consciousness come into being. I think when the TV happened, when the radio happened, that also allowed major shifts in consciousness towards a democratization of culture and life. And so technology can help drive these, the democratization of human life as long as we use these technologies wisely. So it's just a matter of time until medicine is more and more shaped around the individual and personalized medicine instead of being shaped around doctors, hospitals, and labs. You know, there's a story that in London, back in the early 100 years ago, there was just horses. And so the excrement was piling up in London and making it unsafe from a public health standpoint, making it an uninhabitable place to live because they couldn't get rid of all of the horse dung and that sort of thing. And so there was lots of interest in how do you fix this problem? Well, then cars were invented and the problem disappeared almost overnight. And I think technology done wisely is going to help solve a lot of our healthcare problems, but we need to keep the individual person in view and realize that it's the person's health that matters. We don't want to turn technology into a new thing that, like medicines and current healthcare, it's not really about the human person. It has to be shaped all around the individual. So spontaneous remission. Spontaneous remission is also known as St. Peregrine's tumor, historically. St. Peregrine is the patron saint of cancer and illness, and he was a priest who was afflicted with cancer of the tibia, which is the leg, requiring amputation of the leg. This was back in the 13th century. On the night before the operation, he spent the night in prayer before a fresco of the crucifixion and reportedly fell into a deep trance-like sleep. He thought Jesus descended from the cross to touch his leg, and in the morning the cancer was gone. So we heard about trances and hypnosis this morning. This is all very relevant to that. He fell, and these states are fascinating, and it's amazing what sometimes happens in them. He fell into this deep trance-like sleep, and in the morning the cancer was gone. The cancer reportedly never returned. He died many years later at approximately 85 years old from different causes. And so he's considered the patron saint of spontaneous remission. So for me, the question is, what shifted? What happened in that trance-like state? Because again, we're going to talk about these 4 pillars of health, but like I said yesterday, I'm really interested in these beliefs, because I think that's where the money is, and it's an unmapped terrain in medicine for sure. But whether it takes 10 minutes or 10 years to have a healing, I think the mechanism is the same. And it's at the deepest level, it is about coming to a different experience and set of beliefs about who we are in the world. And so that's a really big topic. But we'll try to skim the surface as much as we can today on that. So there's lots of stories. Some of these, I tell a lot of these stories in my book, actually. And I should say the book is going to be available in Portuguese and French and in a bunch of other languages. So if you get interested, you don't have to try to struggle with the English. So let's talk about the 4 pillars of recovery. From my perspective, and this is again, we need to study these people because I'm sure that other people studying them will also have their own insights, but these are amazing stories and they're much more commonly occurring in our culture than we realize, because these are stories without a voice. These people have nowhere to go with their stories. Doctors don't want to hear it, usually. It's fascinating to me that of all the people I've talked to, no one has ever had a doctor who got really interested in what happened. Usually, if they don't get irritated and dismissive, the best that they'll do is they'll say, well, whatever you're doing is working. Just whatever you're doing is working, so keep doing it. But they never get curious about what in the world is going on here. So I think that's fascinating. Jill Bolt Taylor, who has one of the most watched TED Talks of all time, because she was at McLean Hospital where I work. She was a 36-year-old neuroscientist who had a stroke. And then she had a full recovery from her stroke, and she's got a fascinating story. A neuroscientist recovers from a stroke and then had the first TED Talk that went viral. She's been regarded by Time magazine as one of the most important people in the world, and Oprah has been working on doing a movie on her life, and she's got all of this stuff. She said, when she's been a mentor for me on my book project, and she said, when we first met, she said, I've been waiting for you for 22 years. She said, in 22 years, not a single doctor has ever asked how I had a full recovery from my stroke. And I just thought, isn't that just amazing? So we got to change that. So there's these 4 areas I think are really important for most of us. And I think nutrition is a really big topic. We'll talk a little bit about that. And then you have to heal your relationship with the immune system. That's also a really big topic. and heal your relationship with stress. Too many of us live in chronic fight or flight. I think stress is great if it's challenge stress, if it's a stress that you want to learn something, the stress of running a marathon or the stress of in a difficult relationship, and you want to really learn how to do this in a way that helps you grow. That's challenge stress, and that's great, and that can be a healing sort of thing. But if you view it as a toxic stress where you just are struggling to get through it, you just wish this thing would go away, you don't want to do it, and it's just too much, then the stress hormones and all of that, the cortisol, all of that can be difficult for your body and place you in a situation where it's difficult to heal. And then, of course, identity and beliefs. I think that's where the money is in terms of healing our identity and healing our beliefs, and that's where healings can occur even if you don't do the other things. So, Claire is a lady I've learned a lot from. Claire was diagnosed with pancreatic adenocarcinoma. That's the worst kind of pancreatic cancer. She was diagnosed by biopsy in 2008. She has a great story, and I start off the book with her story actually because she's just this grounded, salt-of-the-earth person. She believes in science. She usually does what doctors tell her to do. But in this case, when she was told, well, you can get surgery, that's going to give you maybe a little bit more time, she decided to not get surgery because she looked at the side effects online and she did not want to live with the results of the Whipple surgery, which is a really surgery, and she didn't like the chances of the side effects with pain and digestion and all kinds of things that she would probably be living with afterwards. So she decided she wasn't going to do that. She decided not to do the other treatments because she decided if I only got a few months to live, I'm going to spend it with the people I love rather than sitting in a dark doctor's office with other people who are dying. And so that's what she decided to do. That's a very personal decision. She would not have anybody follow her path on that, but in her situation, she decided if I only have a few months to live, I'm going to focus on the time with the people I love. And that's what she did. So she did and she has a website called livingwithpancreaticcancer.com, and that's another reason why I tell her story is she's got such a detailed website of talking about her nutritional changes and all of the things that she changed in her life, and it just makes a lot of common sense. Now, she said that she doesn't get completely specific about nutrition because she said one woman came to her with cancer and said, "What did you do?" And so Claire told her, and she did that, and she still died. And so Claire is very clear, as I really believe that she's right, is that there's some general principles you have to understand about nutrition, but our nutritional needs are different for all of us, and we have to really understand our bodies and what works. And so it's not a one-size-fits-all. I purposely tell the story in the book about someone who used the keto diet, for example. And even though there's a lot of research that needs to be done on that yet, I think we just need to understand there's some individual differences here. I think what's common throughout all of these different dietary changes that people tend to make are that they tend to eliminate most processed foods and chemicals. They tend to vastly cut down on the sugar, on the enriched flours, and the animal products. That is something you see over and over and over again, whether a person is in a keto diet or a vegetarian diet, as Claire was, or what. I think that, especially in the world that I live in, the processed foods are just so prominent, and they're loaded with so many different chemicals, and the meat has often been, at least in the United States, has been raised in very cruel, confining conditions with lots of chemicals, steroids. The animals are unhappy, and they have a lot of chemicals in them and antibiotics, and I think that's probably not great for the human either. So, sugar. Average person in 1800s consumed 2 pounds of sugar a year. We now consume, at least in the culture I live in, 152 pounds per year. The body cannot absorb all of that. And so so that's why I love desserts, and I have them, you know? I mean, and chocolate, great chocolate, especially dark chocolate is fabulous for you, especially neural chocolate. But we also have to realize that many of the processed foods are loaded with sugar, and I enjoy a great dessert, but it's not the main thing I'm eating these days, you know, and I had to dramatically change. It's actually a difficult transition for me because I didn't realize I was addicted to all of this stuff, and it was very difficult for me to make that transition, but it happened. So it is fascinating that 88% of survivors converted to vegetarian diet, which is, I really do believe that our body does really well with lots of fruits and vegetables that have not been processed heavily. I also think, though, that Claire's point is really important. If you work to improve your nutrition because of fear, if you've been diagnosed with a disease and you're really changing your nutritional level from a place of fear, that dramatically cuts down its effectiveness. I think that fear is a bigger story than nutrition, actually. I think you can probably eat cat food and get better if you really deal with the fear. Okay, so now let's look at so nutrition is a big topic. We don't have time to go into that more deeply today. But if you want to read a good book on that, I think Eat to Live by Joel Fuhrman is the book I mentioned yesterday. I think that's a really excellent book. So the second pillar, healing your immune system. This is a really big topic. Louis Pasteur was brilliant. He's the father of the germ theory. He basically said, diseases are caused by germs. You got to get rid of the germ. You got to nuke the germ with the antibiotic, basically, and then you'll be good. Claude Bernard was his colleague, and they went back and forth their entire professional lives. And Claude Bernard said, no, you cannot think of it that way. He said, bacteria cannot invade a healthy body. If you are healthy, you cannot get sick that way. And disease can only thrive in a poor terrain, which we call that the microbiome now. Is the microbiome, how familiar is that to all of you? Is that a new word or? So it's starting to become more talked about. It has not permeated clinical medicine yet because it takes 30 years or more for medicine to catch up with what is being found in research. So you need to know about this now, I believe, because it's going to take decades before it really changes clinical medicine the way it potentially is going to do. So Claude Bernard said, you know, if you got a pile of trash in the middle of the road or a pile of excrement, is it better to just keep waving the flies away or better to remove the trash? And I think that's a really good understanding of things. I think that we need to create vital, healthy immune systems that keep illness out. And I think that's a much more powerful way to go, but we don't even know how to understand that. And I think Claude Bernard really did understand it. And so he was standing in front of a classroom. You've heard of the cholera epidemic, right? And so he drank a glass of cholera to just make his point that if your body is healthy, you're not going to get sick, and he did not get sick. And so I think that we need to start really tracking that down. I'm a big believer on that. It's a more complicated way to go, right? I mean, it's real simple to say, oh, you're sick, just nuke it, you know, get that antibiotic. And Claude Bernard said, no, you have to build vitality, you have to build the immune system from the bottom up, and then you're good. And I think the microbiome is a beginning of that path, honestly. So Louis Pasteur, on his deathbed, according to the biography written by the son-in-law, said that Louis Pasteur said Bernard was right. The terrain is everything, the germ is nothing. So Hippocrates said that all disease begins in the gut. The microbiome is a vast ecosystem of beneficial microbes, and so by decimating those microbes over and over again, we're really hurting our immune system. Now again, I mean, I work in a medical hospital every day. I see the power of antibiotics, but to have that be the only tool in our basket and to be using these things over and over without building up a healthy microbiome, I think is really a problem. So all these microbes are really good for us, and so you don't want to wipe it out. The small intestine is 22 feet long, it's an inch in diameter, piled like a plate of spaghetti in the center of your body. It has thousands of villi, like shag carpet, for absorbing all those nutrients. The large intestine is 5 feet long, 4 inches wide, hosts the largest microbiome in your body. These two organs are a massive part of your immune system. It's really the center of your immune system, and so you want to make that be a really healthy, vital part of your body. We are more bacteria than human, 100 trillion microbes, good, bad, and neutral, 100,000 species, 10 times more microbes in your gut than cells in your body. And so, are you bacteria? Well, so the human genome is 23,000 genes. The microbiome is 8 million genes. Human DNA is 1% of the total DNA of who you are. And so 99% of your total DNA is microbial and modifiable. And if you just keep decimating that and wiping it out and not nurturing it, and it's like getting rid of your additional hard drive, right? I mean, we need a big hard drive, just like we need a smartphone. I call my smartphone my second brain. We need a hard drive to manage all kinds of things in life. It takes care of anxiety and depression, and it looks like the research is starting to show that it has a big impact on all kinds of diseases. So, new research, you know, what we've had are all these silos, these tunnels for many years in medicine. Cardiologists look at the heart. The neurologist looks at the brain. Psychiatrists look at the mind. Gastroenterologist looks at the gut. But what we did not do is stand back and see that the big picture is really this common pathway to many, many illnesses is inflammation. So if you have inflammation in your body because of the dietary choices that you've made, or because of your relationship with stress, for example, if you're living an inflammatory lifestyle and an inflammatory diet, you're creating inflammation in your body, and so it's just then based on what your vulnerable place in your body is that it's going to result in a disease, whether it's heart disease or an autoimmune illness or something like that. So illnesses, I believe, are the smoke. Inflammation is the fire. So treat the cause, get rid of the inflammation. So I think that's important. Anti-inflammatory foods in relationship with stress. So this is a sensitive system. The epithelial lining of the gut is 1 cell layer thick. That's thinner than an eyelash. It's the barrier between the inside of the gut and the rest of the body. And so if you're just dumping all of these chemicals and processed foods and your relationship with stress into your gut and into your body, it's a sensitive system. So it needs to be treated with care. When inflamed, it cannot do its job properly. And there's still a lot of research to be done, but the early research is showing that there's a lot of illnesses that can be influenced and even prevented or changed very much with by addressing the microbiome and the issues around inflammation of the gut. And there's good books on this stuff I can refer you to if you're interested. There's a good book that just came out called Heal Autoimmune, and that's a good book as well. So we'll see how much the research over the years really is able to unpack around this, but it's a very different way of thinking and has a lot of promise. And I'm sure there's going to be lots of resistance too, because it's such a different way of thinking, and in medicine we don't change easily or quickly, and so you have to have a really skeptical eye around some of the comments that are going to be made about this stuff. But you want to, build a real evidence base that really understands the issues. So, stress is starting to be talked about in medicine, in clinical medicine. I think the population, many people are ahead of where I think many of the medical treaters or doctors are with this in terms of not really dealing with stress. Working in the medical hospital, part of my job as a psychiatrist, I just walk in and ask, so I usually start with, okay, so have you had much stress lately? And people it's a cathartic thing. There's so much stress going on in people's lives, and we don't even talk about it in medicine because it's not even usually asked, because Visitors are thought to be under so much pressure to just figure out what the real symptom is and treat the symptom. And stress is driving so much of what's going on. There was a woman not too long ago who came into the emergency room with chest pain. And so she was evaluated cardiologically to see whether she was having a heart attack and decided she wasn't. And so when I talked to her, I decided that she was having a panic attack and asked her if she had much stress lately. Well, it turns out she was 64 years old. Her husband, she broke down into tears and she said her husband had just left the day before. She had been with him since age 15. She had never known another man, and she had never dated anyone else, and he announced the day before that he was moving to Florida with somebody else. And she was devastated. She was absolutely unprepared emotionally and psychologically to be able to deal with that kind of devastating loss. So I told her, boy, you've got to deal with this, and tried to help her find some help for it. She was old school Catholic. She said, no, good, that's not what's going on here. And then she was back in the emergency room a month later with chest pain, and this time she had atrial fibrillation. Can I prove that there's a connection, a causal connection between what the loss that she had and the atrial fibrillation? No, I cannot prove that, but I've seen this stuff happen over and over and over again. I know that what goes on in the mind can have a deep and profound impact on the body. So, again, 80% of hospitalizations and most office visits are related to stress, and so those of us in medicine, we need to be asking what's going on in your lives, not just the symptoms. We've got to ask what's really going on, because people are experiencing a lot of stress, and that's very relevant. Have you ever heard of the Adverse Childhood Experiences Scale? Is that something you've heard of? You can look that up if you're interested. That's another one of these things that should change medicine and probably will, but you don't want to, you'll probably be dead before it does. If you look up the ACEs, Adverse Childhood Experiences Scale, you can just type that into Google, and it's a great, it has a lot of implications for changing medicine. What happened was there was a doctor in California, in San Diego, a few decades ago, and he was running a preventive medicine clinic, and he was helping people change their nutrition and then watching all of this weight drop off. And then he couldn't figure out why these people would lose all this weight and then leave the clinic and regain all the weight. He couldn't figure out what was going on because they're making all this progress. And then he made a mistake, actually. He was interviewing a young woman, and he meant to ask her, how old were you when you started having sex? But instead, he asked you, how much did you weigh when you started having sex? And she began to cry, and she said, 60 pounds. And he was shocked. He was, what? And then he realized he'd asked the wrong question. And then she told him that she had been sexually abused as a child, and she helped him understand that for her, weight was an insulation against having contact or connection in a world that felt very frightening and unsafe to her. And she said, basically, invisible is what I need to be. And he began to realize, and he did a big research study and began to understand that the stresses from childhood have a massive predictive value for the medical problems that a person will then later have as an adult. And so that is a really important study. It's a really well done study that's just not talked about enough in medicine, and it has a lot of relevance for the heart disease and the diabetes and all of these things that create inflammation in the body that down the road eventuates in disease. It has the ACEs study, it takes about 1 minute to take. It's a 10-question thing, and you can take it online, and those 10 questions are very suggestive for helping you begin to think what your vulnerabilities are, and you can read more about it online. There's a lot of information that's starting to develop around it. It's the early stages of really beginning to understand the ways in which trauma and stress in childhood can impact the adult body. So again, there's been parasympathetic states that's been talked a lot about this weekend, and the importance of getting out of fight or flight and into a more anti-inflammatory state, the relaxation response. Those kinds of things are really important. So, now the fourth pillar. This is the thing that I understand least, but I need to understand most. This is what I'm going to be putting a lot of my future research into trying to understand. I believe that we are all a complex compilation of true and false, conscious and unconscious beliefs that we've acquired in the course of our lives from parents, from the ways in which we interpret the experiences that we've had, from the ways we interpret things on the playground, from the way we interpret things with peers and colleagues at work and in our families. And these beliefs are usually a complex collection of beliefs that are both true and false. And they are both conscious and unconscious. And they have a profound impact on our health and our well-being and our success in life, I believe. I believe that when we give our brains, our bodies, and our lives mixed messages, it just makes sense we're going to get mixed results. And it means that we're kind of fighting a war with ourselves, whether we know it or not. And I think dealing with those seems to be the core of what happens in these remarkable healings that I see when they so fundamentally change their beliefs about themselves and the world. So I believe a power lies within all of us that's waiting to be awakened. We all are much more than we realize. Every person here, every person in the world brings something unique, unrepeatable, and magnificent into the world that no one else can bring. This is true for all of us. It's the most important truth to come to terms with in our lives. And this is not just an abstraction. We can say that we believe this, and that's just an abstraction, but to believe it in a way that we experience it and integrate it into our lives, that's where the money is, I believe. That's what changes everything. That's what changes the entire trajectory of a health pathway. We still train ourselves and our children to see disability and disease where we could choose instead to see an opportunity to become someone. Healing is not about getting what we want. Healing is a healing of identity. It's about becoming our authentic self. I cannot tell you how many people have said to me that they're so grateful for the illness. They had to die to an old understanding of who they were. They had to learn to say no in relationships. They had to learn to, I'm telling you, if you can't say no, your body will eventually say no for you. If you are a caretaker and you're taking care of everyone else and you're doing what you think everyone else needs, but you are not feeding the core, the authentic core of who you are, what your dreams and aspirations are, and even if you think it's selfish, it's not. You've got to feed the core of who you are and not just be taking care of the needs or the perceived needs of everyone else, because it's that dialectic that is at the core of disease and healing, I believe. So, what time we're running behind. What time should I stop? Okay. Oh, 15, okay. So one of the great misunderstandings of modern times, I believe, is that our circumstances define who we become. That's not true. A higher truth is that it's not events or circumstances who define who we become. It's our interpretation of them. That's where the money is, I believe. What distinguishes human beings from animals? Our capacity to choose our beliefs, to choose the meaning that we attach to events. That's, I think, the biggest difference between animals and human beings is we can choose our beliefs and we can choose the meaning that we attach to events. 2 people imprisoned in death camps during World War II. One person interprets it as proof that all hope is lost and commits suicide. Another person believes that love is stronger than fear and hate and uses the opportunity to discover a bottomless reservoir within the human spirit. These are fabulous books. Viktor Frankl, if you heard Man's Search for Meaning, is a great book about this. Louis Zamperini has a great story about this in the book Unbroken by Lauren Hillenbrand. It was turned into a movie, but the movie actually did not capture this, but the book is brilliant. Corrie ten Boom with her book, Hiding Place, and there's lots of stories about the resiliency of a human spirit that overcomes and sees the truth beneath the degradation and misery and realizes that appearances do not reflect the real story. There's a story about, a famous story, a shoe salesman went to Africa and came back and said, nobody wears shoes, it's hopeless, there's no business we can do there. Another shoe salesman went to Africa and came back saying, no one wears shoes. we can sell lots of shoes there. So perception is really a big deal. So I believe that healing our beliefs requires three things changing. We can choose our perception. A lot of times we don't realize the power we have to change our perception. And I'm not talking about positive thinking here. Positive thinking is not going to carry you very far. I believe in addressing our fears and in non-fear-based thinking, because I think fear is what really gets us. But I'm not trying to say that it's about positive thinking. It has to go a lot. If you are trying to think positive, but underneath all of that you have all of these fears that you have not dealt with and developed a capacity for courage, all the positive thinking in the world is not going to help. It's just not. And it's just going to make you into more of a fake person and more vulnerable to illness, frankly. It has to be real. And also our interpretation of what happens to us is a really big deal, and then the action that we take. It can't not just be the problem I've had for years. I'm a professor and I do all this intellectual stuff, and I've learned that you have to integrate it into your life. It has to be working in the real world. What do you guys, you ever seen this before? What do you see? Can someone tell me what you see? Okay, so is this, what do you say? So you see a lady, so say more. What's that? Do you see two ladies there? Yeah. Okay, you see the older lady and the young lady? Okay, 2 minutes? Oh, two ladies. Okay, great. So does everybody see that? I can explain how to see the other one. Okay. So what you see, I mean, we all have different perceptions about things, but it's really helpful if you decide, is this really the most true perception? Is this the perception that I really think is the best, truest understanding that takes into account what's possible in life, that reflects courage, that reflects the higher nobility and courage and the higher capacities that we all have within us? So it's a step forward that abuse is coming out of the closet, but it's a misunderstanding that abuse can really fundamentally hurt us at the level of the soul. We have a victim-based culture. I really think it's fabulous that things are coming out of the closet, but let's don't create a victim-based culture. Let's help people realize the abuse is never really about us. We don't have to be defined by that. We bring something much bigger than that. As human beings, we have a higher capacity that separates us from animals, the capacity to decide what meaning to attach to events and our circumstances. And so it's a process of getting there. It does not get there overnight. Our beliefs are formed from interpretations that are often wrong. For example, a person assumes that childhood abuse by a person, children always interpret the situation as being against them. And as an adult, we can realize that, oh, that wasn't about me. That person had a problem. And we can begin to reevaluate the interpretation that we made. So this gets into another level and perspective on it. We are all creatures of pain and pleasure. We seek to avoid pain and maximize pleasure. And this is a way of understanding what distinguishes us from the animals, the meaning we attach to our circumstances, our capacity to decide what causes pain and what causes pleasure. For example, for many years, I did the typical academic thing of thinking, oh, exercise is not important. I care about the life of the mind. Well, that was really wrong. And now I'm an avid runner, and I care about nutrition and all that kind of stuff. And I have learned to attach, instead of, my mantra really was, exercise less and work more. That was not a good approach. And so now, instead of attaching pain to exercise, now I gain great pleasure from feeling good, feeling strong, feeling able to take care of things. And so I've attached pleasure to something very different, to something more abstract and long-term, rather than just the short-term pain of actually getting out and running. So if you want changes to last, you have to consciously change your relationship with pain and pleasure. You need to consciously attach massive amounts of pleasure to new actions and attach pain to destructive actions. If you realize what the unhealthy habit is, and you can attach pain to that by looking at pictures of what happens to people who keep smoking or drinking, for example. Or, look at things that show where that unhealthy habit goes, so you can begin attaching pleasure to healthier things and to pain to the unhealthier things. We saw some of this, for example, with Emily Bowler yesterday. We told the story. She had been through a lot. She'd been through a lot of trauma as a child. She'd been through the suicide of a son who had the deadly combination of diabetes with bipolar disorder, and he went on a massive binge with all these processed foods and went into DKA. It wasn't recognized by the medical establishment. He was manic at the time, and the DKA was helping feed the delirium that he was in, and he ended up committing suicide in the middle of all of that. And so she dealt with a lot of trauma and difficulty, but she changed her relationship in a massive way with pain and pleasure. She began to attach pleasure to feeling healthy, to getting rid of the toxic thoughts and the toxic foods that she had been putting into her body, and attaching pleasure to feeling healthy and to treating herself with compassion instead of judgment and the despair that's associated with that. Same thing with June. June was a young, active woman. She had all this physical pain from the ankylosing spondylitis. She went on pain medication for a while, and that actually helped her initially. It helped her just calm down and take a breath and not have this devastating pain. But then she also began to realize that the pain medications were insulating her from having an ability to listen to her body. And so she went into yoga, got off the pain medicines again, and began to really pay attention to the pain, push through the pain in order to get into these poses. And frankly, at one level, I suspect that the yoga poses were probably cracking some of the calcifications that were forming in her body, because the pain during the yoga was very intense for her. But she really wanted to be a mother and a wife and have a vital, healthy life. And so she was willing to go through the short-term pain in order to capture the bigger reward for her, which was the family and life that she wanted. And for her, it really paid off, obviously. So, long-term deep beliefs create the difference between happiness and unhappiness, health and disease, Gandhi and Hitler, feeling purpose and feeling lost, and feeling that you have value versus that you are defective. Our biggest challenges are our biggest opportunities. We are not defined by our circumstances. We are defined by our interpretation of those circumstances and by what we do with them. We are all made of the same substance, no more and no less than anyone else. Awakening the power within us begins by filling our lives with true and empowering beliefs and eliminating false beliefs. So there's exercises that we could do on that if we had more time. I think that if you're interested in this, what you can do is take a piece of paper and write down 2 columns. On one column, you can write true and empowering beliefs, and on the other column, you can write false and disempowering beliefs. I think it also helps perhaps to put at the top of the paper, I am the image of God in the world. And then write down all the beliefs that come to mind for you in both of those 2 columns, and then take the most prominent beliefs in both of those columns and begin figuring out how to strengthen the true beliefs and get rid of the disempowering and false beliefs. So I'm going to conclude. Just want to say we're opening up a new era in medicine. We just need to do this in a way that's really smart and built around the human person, and begin to actually create a science of health and well-being that treats and helps people develop vital lives that are flourishing, that creates healthy microbiomes, that uses nutrition in a whole different way, helps us change our relationship with stress, and especially begins to deal with our beliefs and healing of our identities. And I will release you with that. Thank you.
Thank you very much, Dr. Rediger. It's an honor for us as well to be here with you. And just like yesterday, je veux demander la présence des orateurs qui ont parlé aujourd'hui aussi hier. Dr. Rubin, Dr. Drysdale, vous pouvez descendre. Come join us. And on va commencer la session de questions et réponses. Peut-être je passe le microphone. Je te laisse avec le microphone et je continue. Je continue. Parce que...
Thank you.
Alors, j'imagine que vous avez déjà des questions en tête. Vous pouvez lever la main, voilà. Et dire aussi à qui vous voulez adresser la question.
Merci.
Bonjour. C'est une question pour tous les conférenciers. It's a question for each speaker. Qu'est-ce que vous pensez qu'il faudrait qu'on fasse mieux pour accélérer ce changement de paradigme d'une médecine matérialiste vers la médecine spiritualiste et pour, par exemple, remplir cette salle quand on fait ce genre d'événement? What do you think we should do better? What would be your advices for accelerating this shift from materialistic medicine to a spiritualistic medicine, and to fill this type of room when we do such event? Such a question for all of you.
Question très relevante. So, who would like to answer first? You.
Eu creio que a mudança parte a partir do conhecimento. E dentro da parte que me cabe, como presidente de uma associação médico-espírita, os périplos na Europa têm sido muito importantes para levar a medicina espiritual ao conhecimento das criaturas. Então, acho que esse é o grande caminho. O caminho através do conhecimento, levando os ensinamentos, como aqui aconteceu nesse congresso, trazendo as noções, cada um com suas características, com seus conhecimentos, com seus estudos. Vamos sair daqui, obviamente, ampliados em conhecimento. Então, as associações médico-espíritas, e no Brasil hoje temos em torno de 70 profissionais da área de saúde, e eu não me esqueço jamais das palavras do grande médico, Dr. Adolfo Bezerra de Menezes, que é o patrono de todas as AMEs, associações médico-espíritas. Ele nos disse, certa vez, que a porta de entrada do conhecimento espiritual seria através de Portugal. E realmente começou a acontecer isso. Está havendo essa difusão, essa ampliação de conhecimento, como está tendo aqui na Suíça. Estive agora recentemente na França. Eu acho que esse é o grande projeto. Projeto que vai crescer naturalmente e aliado à ciência. Pois é a ciência que vai alavancar todo este processo e vai haver as naturais mudanças e seus respectivos paradigmas. Eu acho que é esse o caminho.
Thank you. Thanks.
So perhaps I should give you also the opportunity to add to this answer.
Can you repeat what the question was? It was about?
It's a question about what we should do to make this, raise the awareness to this new era of medicine, so that in the future when we create such a symposium like this, we have a really crowded room full of people interested in doing it.
Yeah.
So what we should do, what is it that we perhaps should be doing better?
I think that all of us need to take responsibility for our health and well-being and focus on that. Were you going to say something?
Yeah.
Go ahead.
Go ahead.
Well, oh my goodness, I'm having a tech challenges for sure. Well, I think just every day kind of encouraging, speaking about, as I mentioned in my talk, by including the term spiritual in our dialogue, just gradually raising the awareness, using some of the techniques from that have been suggested through hypnosis and in helping to suggest people be more interested in some of these things, and just working our way. I think suggesting books, as you mentioned, the one by Viktor Frankl about meaning, and I like to suggest books for patients to read, and videos as well. But I'm appreciative for everybody who's come to this conference to hear these things and to do what they can in talking about it with their friends and encouraging others to participate next time.
Yeah.
Yeah, I find it a very interesting and very important question. In my opinion, I think if we would learn from the start, as I said in my lecture from the second grade maybe, perhaps earlier, every healing is a self-healing with the imagination as the elixir. And academic medicine, I'm a big fan of academic medicine, but academic medicine is adjuvant. It's in addition to the self-healing powers. And in the end, we must heal ourselves. So therefore, learning self-healing already, let's say in the second grade, and then every year improving or making it appropriate to the age until we get out of school. Yeah.
If I could just humbly add something else. I think when we go into a plane and then they show all these instructions of what we should do in case of an emergency, they say, oh, if there's depressurization of the cabin, and then first you put on this mask on yourself, and then you help the children beside you.
Yeah.
And I remember the first experience in a plane, I heard that, oh, that's so bad. First I should look after the children. Why is it so bad that they give this message in the plane? But then I realized, and it's the same thing that you actually said, first you have to look at yourself, because if you can't do it, you can't really help the others.
Right.
Okay, thank you very much for your presentation. I would like to know if in your research you understand any sort of connection between traditional medicine or traditional knowledge and this new era of medicine. Because, yeah, I recently finished a research about the knowledge of traditional midwives, and was really interesting to see how they understand the women body and health and this whole health perspective in a more deeper way than Western medicine. Não sei se eu falo português. It's for all of you who feel you can answer.
I have the microphone, so maybe I'll just say, I don't know, the work we do in immunology, taking the placebo effect serious, the transcultural views, what we were saying, the multimedia, seeing what other cultures do, your own work, just being more aware that there's more to what's going on. There's a nice way I like to look at the world, that we are the way for the universe to get to know itself. human consciousness. And so there's many different ways. And as we just said in the last talk, I find it very important to take into account our own contribution to healing and hope that the work, for example, in this Congress would flow more into the medical school, the traditional, normal, let's say the Western medical school.
Sure. I'll just say this, I have a mic on yet. I think that's a really great question and a really lot to that. And I think every person brings their own kind of universe into the world. And in medicine, we are often taught to exclude the individual story of the patient in order to penetrate through to the underlying signs and symptoms of disease. And that focus on disease instead of on the person takes us in a really different path. And every person has such a unique path. And so if you sit down and actually ask the person what their story is, what do they think this illness is about, or what is the stress in their lives, you get the story of an individual human being, and it takes you in a really different direction in terms of things. And that is a new direction that we need to foster. And it takes us into, because most research studies have been done on, a lot of times on young white college students, for example, that may or may not be at all relevant to what life is for the average person in their real life.
Bom, a minha questão tem muito a ver com o que o Dr. José Henrique disse ontem. A partir de um momento para outro, eu comecei a ter vários tipos de problemas de saúde. Primeiro foi uma cirurgia de joelho, depois uma cirurgia de ombro, uma rectocele, agora uma ATM, que já está marcada, uma nova cirurgia para um ombro, e a última foi agora em agosto, o meu pé. E eu sou uma pessoa muito estressada, que me dou muito às pessoas, e com isso sou muito introspectiva também, guardo muito para mim as coisas. E eu tenho que mudar isto, porque com o que você disse ontem, eu acredito que tem tudo a ver com isso que está se passando com o meu corpo.
Eu agradeço o seu lembrete e saber que, de alguma forma, nós estamos aqui contribuindo para esse entendimento, essa compreensão. E exatamente minha linha de trabalho, ela se pauta exatamente nessa compreensão. Compreensão das nossas emoções, compreensão das nossas personalidades, do nosso caráter, como isso é difícil, ter essa humildade de compreendermos quem verdadeiramente somos. É um trabalho profícuo, é um trabalho infatigável, de muito treinamento, de muita compreensão, de muita humildade. A minha linha é exatamente que isso ocorra. A terapia floral de Bach, gosto muito da terapia floral de Bach, nos proporciona, através dos florais criados pelo insigne mestre inglês, Dr. Bach, nos proporciona essa autovisão. A terapia regressiva de memória, que eu pratico também no meu consultório, traz a lume na consciência os fatores do passado, fazendo as suas correlações com o presente, mais uma vez proporcionando o autoconhecimento. E no campo espiritual, trabalho em mesa mediúnica, sou um médium, e as conexões espirituais, pela comunicabilidade dos espíritos, que não é novidade, nos mostra quem verdadeiramente somos, porque não estamos só ajudando os espíritos, estamos vendo pela lei da sintonia, porque a mediunidade, ela cumpre a lei da sintonia, da afinidade, para verdadeiramente também analisarmos quem somos. Então veja que essas três linhas, Esses 3 paradigmas nos proporciona sempre essa autovisão, esse autoconhecimento, porque se não houver isso, não vai haver transformação, não vai haver as devidas mudanças. Muito obrigado.
Encore deux questions?
Eu gostaria de agradecer muito a cada um de vocês pela palestra e pela presença tão genuína. Eu acho que isso é, eu diria, 100% da cura, é a pessoa estar presente genuinamente, expressando quem ela é. E vocês virem aqui e expressarem genuinamente quem vocês são, com tanta empatia, dividir o conhecimento que vocês dividiram com tanta humanidade, carinho e respeito, é inspirador e é um empurrão para o processo de cura. Então, eu teria muitas perguntas para fazer. Eu vou voltar para casa com muito mais questões do que respostas, isso é muito bom. Mas eu gostaria mesmo era de agradecer, porque isso é brilhante, a gente vê a história de cada um de vocês e como vocês mudaram a forma de enxergar a vida, vindo de uma determinada formação e passando por cada etapa da vida e usando isso a seu favor em autoconhecimento. Então, isso assim me toca profundamente, eu tenho certeza que toca muito os nossos colegas, amigos aqui presentes, e eu acho que this is the gold, o autoconhecimento. So, thank you so much, and all the best for you all.
Thank you.
Thank you, Vivi. I think she really phrased it in the best way, all this gratitude that we all feel for you. Thank you very much.
For all of you too.
Quero agradecer a vocês todos de estarem aqui, a doutora Sônia Doi, que teve a inspiração de enviá-los aqui para a Suíça, a presença novamente do Dr. Gary Schmid, que veio num evento também na Universidade de Genebra, era um outro pavilhão muito antigo, em 2010. E essa comunhão nos faz muito bem. Eu agradeço muitíssimo a vinda de vocês e, sem querer fazer concorrência ao Gary Schmid, uma produção lá da minha cidade. Muito obrigada.